Welcome to Science of Slink, the evidence-based pole podcast with me, your host, Dr. Rosie Boa. And just to be very clear, I'm not a medical doctor. I cannot treat or diagnose. I'm the type of doctor that does research and reads research articles. And that's part of what we're going to be doing together here in the podcast. We're going to be reading research. We're going to be synthesizing that down into things that you can apply to your pole practice. We're going to be talking with experts in their field and learning more. And overall, just really building our understanding of how bodies work, how we can do pole better, train more effectively, train more safely, and just have a better time overall. So if that sounds like something you're interested in and you want to come get a little bit nerdy with us, come on in. All right, so I am joined today by Val, or Valerie, I guess Dr. Val Oliphant if we're being fancy about it. But welcome. So I usually have people start off by introducing themselves, talking a little bit about what it is they do, their background, maybe how you got into pole, just anything you want to share from your story.
My name is Val Oliphant, and I'm a doctor of physical therapy, and I specialize in pelvic floor and dance rehab. So I see about half and half. And before PT, I was a professional dancer and dance full time. I used to run elevated teacher trainings, which is out of body and pole, and they do pole dancing teacher trainings. I got into pole. My mom is a professional costumer, and so I grew up doing a lot of musical theater. And I always got cast as the dance lead. So eventually I kind of took a hint and I pursued mostly dance. So a lot of tap, jazz, a little bit of ballet. And so I was teaching a ballet class at a studio that also had pole classes. And I took a class and was super hooked. So.
I think a lot of folks can relate to that journey of starting with sort of more, I don't know. I don't necessarily want to say traditional dance because there are a lot of dance traditions, but I tend to call it commercial dance because I think, it is a career path that is separate from some of the ways that people are pole dancers.
That makes sense to me.
So you're obviously, when you come to pole, you're bringing in a lot of that dance background that you have, and also since you've become a physical therapist, also your physical therapy background, and of course your pole specific background. And I wonder, what are some of the things that you tend to see really commonly, given all your backgrounds together, that you're like, if you could fix this, if you could use like this one thing, your life would be so much easier. What is that one thing for you?
Ooh, I feel like that is a really hard question. I think recently, like the past, I'm going to say 5 years, there's been kind of a shift in focus in terms of like bridging that like active passive flexibility gap. And I really love that. And I think something that kind of applies to a lot of dancers and pole dancers is doing that end range strengthening. So that when we're asking our body to be in like full shoulder flexion on holding up our whole weight on the pole, it's not a total shock to the system. Mm-hmm. So, if I had to pick one thing.
I think that's a great thing to pick. I think I also have seen that certainly more recently, because thinking about, back in the, I don't want to say the bad old days, but there's certainly been like a lot of change in how pole is taught. And I think there's still a lot of room for, further positive change, which is good, right? Like the field is evolving. But you don't see a lot of people encouraging people to just like sit in oversplits as their warm up anymore. Which if you were doing that, I hope you have a specific reason for why you're doing that. And that it meets your not psychological, physiological needs for the specific thing that you're doing.
Yeah. And I think there's also been more awareness, which I really wish I had known when I was younger, on how the nervous system kind of interplays with flexibility. And I feel like so many times I thought I was stretching my hamstring and I was really just like cranking on my sciatic nerve, and would have been a lot happier and a smoother journey if I hadn't done that.
Yeah, absolutely. And I mean, even sometimes these days, I will hear people say something like, find your forward fold and then flex your feet to deepen the stretch. I'm like, that's not what it's doing. I'm going to choose not to do that. But thank you for your input.
Yeah, totally. And it's nice to be in a place where you can elect not to do those things and kind of do the things that serve you.
Yeah. And for folks who might be listening and are not 100% sure what we're talking about here. So whether your feet are pointed or flexed should not change how your hamstring stretch is feeling in terms of the muscle. If it does change something, it's probably nerve tension. And generally nerves don't enjoy when you just sit on the end of the range of motion and tug on it. They like gentle movement back and forth. And I generally prescribe, I can't prescribe anything, I'm not that kind of doctor. I generally recommend under 10 reps a day. This is not a more is better sort of thing. Feel free to jump in and be like, 10 reps? That's not what I do at all.
I usually also say 10, and I tell people that, I think your nervous system also changes very frequently. And so I think it's nice to include one in a warm up, and you're kind of like, oh, today maybe I have like a lower threshold, like I seem to be a little more stressed than normal. And that could just be from sleep or any number of factors that are affecting your nervous system.
Yeah, definitely. Definitely. And I know we talked about the sciatic nerve, but like, I would say for me, in my students, I tend to see sciatic nerve tension most commonly. I would guess probably 80% plus of dancers I've worked with who like we've done nerve stuff have had. Femoral nerve. So for things like lunging in that front hip, if you move your head and you notice a change, it's not your it's not your hip flexors, it's a nerve. And I would say for my students, I would say probably 40 to 50% of people have that. And then the other thing that I do see quite a bit is ulnar nerve tension. So, down the side of the arm. And for that, I would say probably closer to 15 to 30% of my students, I see that. And I don't know if these are population levels, if it's just like the people who happen to come to see me. And, it's not a bad thing if your instructor's like, do a nerve glide. And you're like, I don't feel anything. Good.
Yeah, that's great. Yeah.
Congrats.
I would agree with that. And they're easy to throw in and not like a heavy lift. So I think that's nice.
Yeah. Because I'm trying to remember when the first time I actually like got explicit, like someone in a class talked about nerve specifically. And this is, I don't want to get on too big of a tangent, but here I am not talking about the vagus nerve stuff, which I think has been, given the evidence that we have from the research that seems to be applicable at a population level with a robust effect size, very, very much overstated the effect. So not that, but like specifically nerve glides and movement. I think it probably wasn't a contortion class actually, and it might have been with, it might have been at Fit and Bendy, or it might have been at Versatile Arts in Seattle. Both places I've trained Fit and Bendy only online. And then I've definitely been seeing more and more of it in the pole world as well, which is great. Because for a lot of people, it is the limiting factor.
Yeah, I think Dr. Jen Crane does a lot of really great work on that too with MyFlex. I like her stuff a lot.
Yeah, absolutely. Fantastic resource, especially if you're interested in working in more of those sort of extreme ranges of motion, or even if you're not, right? Talked about sort of the one thing that people could like, if there was one thing they were like, maybe think about this. But I'm also interested, what do you think the sneakiest thing is, right? Like, what do you think that people might not notice until it suddenly becomes a problem? And then it's a really big problem and takes a while to deal with. And this could be like technique-wise, this could be injury-wise. As I'm asking this question, I actually know what my answer to it would be, but I'm interested to hear your answer.
Okay. I feel like I would like to hear your answer also.
My answer is, and again, I am not a medical doctor. This is just from me working with my students. Probably elbow and wrist tendon stuff from trying to progress too fast. Because ligaments and tendons, they don't have a lot of blood. It just takes a longer time for them to adjust to a lot of extra load that you're giving them. So I think, especially when people come in, if they have a lot of successes really quickly, which is, can be common, depending on your fitness background, you then really push your body past the point where it's able to adapt. Maybe your muscles are adapting just fine. Maybe your neurological system's adapting just fine. You're learning stuff, but your tendon and ligaments aren't there. So I think trying to move too fast and ending up with something that takes friggin' ages to heal is, I think it takes up on people. And I think people don't realize that it is an issue. And like that little twinge in your elbow or wrist, you should get that looked at sooner. That is not a thing to sleep on.
I would agree with that. I think if like, especially like if it only hurts you kind of initially, or maybe if you do a couple things, you can kind of easily override and be like, man, it's not a big deal. I think same with shoulder issues. Sometimes people will sleep on those. Same exact thing, whether they're kind of like progressing really quickly. And I've had students that have cannot do an Aisha, but are doing handsprings, and they're just kind of like whipping themselves into it. And it's like, okay, if the muscle isn't there, the ligaments are sort of taking the brunt of that action. So I definitely think that that is like, and often like not something that needs, if you catch it early enough, like you don't actually need like tons and tons of therapy for. Some people I see for 3 or 4 sessions and send them on their way, or sometimes even less, depending on kind of where they're at. But I think when you come in and you're like, oh, I've been having this for a year or so, that's a lot harder than a couple weeks. So I think something that kind of sneaks up on people is just sort of muscle imbalances. And even though, you know, we all know kind of that stereotype of like only doing stuff on one side, but it really does like eventually catch up to you, especially the more advanced you get. And I totally myself am guilty of this, but like knowing that I can do like very like a beginner class on my left side and like an advanced class on my right, and like maybe that shouldn't be the case. So and I think there's plenty, especially once you get to performing, there's plenty of times where you're going to end up on the other side and have to be able to kind of everything, not everything, but some of the things on the other side. So I think it's, even though it's harder, like I've been retraining my handsprings recently as an example, and I can barely hold an Aisha on my left. So that's where we're at on that side. And then my handsprings are fine on my right. And so I just kind of do both those things, and I'm slowly like attempting to elevate both at the same time.
Yeah.
So.
And I think there is like, I don't know, I think part of the reason why people might sometimes know they have an imbalance and continue to have an imbalance is that you think that you have to completely stop training the strong side while your weak side catches up. You absolutely don't, especially if you're doing, you know, cross training. It'll catch up more quickly. I, as a teacher, I'm a little bit more freestyle focused, and so I am very insistent that people do both sides. Because for me, the point is not to get the trick necessarily, right? The point is to be able to explore new things in your dance. And B, when you're freestyling, there's just more variation in what you're doing. So the likelihood that you're going to be able to like think and be like, I'm doing something on my left side, so I need to start on my right side. Because A, you don't have your past planned out. It's just going to sort of happen. And B, I didn't have a B. That's it. That's the end of the sentence. I don't know where I was going with that. I started doing bullet points and there was no other bullet point. No.
But yeah, I would agree. And freestyle, you never want to just be there and like, oh, how can I only do stuff on one side in this? And so it's just much easier and will allow you to kind of access that flow state if you're able to do both.
Absolutely. Absolutely. And it also, it's interesting because it's not something that, so in the folks who listen to the podcast a lot will have heard me talk a lot about variability of practice and some of the motor learning research. I have not seen a whole bunch, and to be fair, I haven't gone and dug into it significantly. I haven't seen a whole bunch on, you know, lateralization as a way of doing variability, but I do know that there is some work on that in baseball, and that, you know, some people will intentionally train right and left-handed baseball things. I'm not really a sports person, but like intentionally to try and like, I think they're trying to like fake out their opponents and like not let them know what they're going to do ahead of time. So it's a little bit more strategic, but I imagine there's also a motor learning benefit to doing things on both sides. That's an empirical question.
I don't know about with sports specifically, but I know they've done research on that with stroke patients on training their unaffected side and seeing gains for the motor learning on the other side. So it wouldn't surprise me if that also applies just generally.
Yeah, you'd think, right? So we talked about, sign up something very common that you can, like, quick fix you can do, thinking about, you know, nerve tension, noticing nerve tension. Did we talk about what nerve tension felt like?
I don't think we did.
Yeah, we talked about like if you're moving the joint that is not the joint that you're stretching and you're feeling a change, and probably it's not muscular. But it might also be helpful to be like, this is what it feels like in your body, or at least for me, because I don't know how much variation there is from person to person and what the actual physical sensation is like.
Yeah. I can only speak to what I feel in my body and kind of what people report feeling. I think a lot of people will lean into it because it feels like a stretch. I would say it feels kind of more like I'll put this in quotes, bad stretch than a good stretch, in that like it's kind of hard to push through it and you're just kind of like, oh, this doesn't feel great. And ideally, like a general muscle stretch shouldn't feel like super painful. And then sometimes people will have kind of nerve, like kind of electric shocky, numbness, tingling stuff. But that seems to vary, I would say.
Yeah. Yeah. I almost feel it as a tugging a little bit as well, rather than like a stretch feels more like the way I imagine it would feel if you were dough that had been kneaded and were being left out to rest, right? Like the whole thing is sort of like being affected, as opposed to there being sort of like a thin line through it, like a hair or something that's being like jerked on. Yeah.
And I would say like generally in a stretch, it kind of feels better as you hold it, and the nerve tension is just going to potentially get worse as you hold it, but certainly won't get better if you're just yanking on it.
But not if you trigger the stretch reflex, right?
That's fair. Yeah.
Do you want to say what the stretch reflex is? Because that sounds good, right? Like I want the reflex that helps me stretch. Sounds great.
I think the stretch reflex can kind of like inhibit that sort of pain modulation by sort of overriding in your brain like what we think is happening in our body. And so if that happens, then you'll maybe not notice that it's as painful.
Oh.
Yeah.
So we talked about, sorry, I was going through the things that we talked about and I got sidetracked again. Sorry, we're recording this a little bit later in the day, and I am, it's been a long day. It's a long week. Actually, we're recording this the day before the show that went on in the past. I hope you all enjoyed very much if you watched it. And if you're dancing in it, I'm sure you did a wonderful job. I'm putting on my future glasses. I just know it to be true. And we talked about some sort of sneaky things that maybe don't seem like a big deal, but are maybe a little bit bigger of a deal than you might think. And then sort of turning to technique, something that you mentioned that sort of perked my ears up that I have also seen as well is regressions and prerequisites and what to do before you do something else. And it's interesting because maybe I'm just an old grump. I started pole with like before pole Instagram was really a thing, or certainly before, I was aware of it. But I do wonder if seeing a lot of people training movements in isolation without understanding the rest of their training patterning and what are the things they're working on, right? Because if you're working with somebody at a studio, even if, you just take a couple classes a week together, you can be like, oh yeah, X is working on, these three things. They were just working on these other things. I can sort of see how that relates. Whereas if I see like, famous pole star do a cool move, I don't necessarily understand how that relates to other things. And I think particularly because I mostly work with home polers, people who are working alone at home may not get that sort of foundational buildup that I would want them to get in pole. And like I have one, and I think like what I think the foundational moves are and what order I think it makes the most sense to introduce them in. And I think a lot of studios do, but there isn't like a standard across the industry, right? It's pretty much whatever a given instructor and studio thinks makes the most sense, right? Like we don't even really have a standard certification. There are a lot of certifications of sort of like varying degrees of utility to different people. But yeah, I don't know. Is this something that you have also noticed? You didn't actually say when you started pole. Might be relevant for the discussion as well. Yeah,
I started pole in 2010, so also a long time ago, and definitely think that there has been like a huge evolution. I mean, I remember like when I started out, I thought like Jade was like the hardest move I would ever learn. And I still love Jade, so I do them all the time. But that was like an advanced move. And I frequently feel like that is like the categories are vastly changing.
Yeah.
And seem to vary widely. Like even if you look at, like, let's say you look at the hashtag PD beginner, there will be moves that are like insane to consider beginner, like a rainbow Marchenko or something like that requires a lot of strength, a lot of flexibility, like I certainly wouldn't try at home on my own. Like there's just like, it's very fascinating to me. So I think there's a lot of that. And certainly if you were somebody who's like kind of learning at home, seeing those as like listed as beginner moves, you'd be like, oh, maybe this is something I can and should be able to do. But I remember it took me a long time to be able to invert. I have like, you know, it just depends on your proportions. I have like most of my weight in my lower body, and straight leg like inverts are still a nemesis move of mine. Like they have always been really hard for me. And that just is, and other people, like they might be able to kind of progress faster and move on from there. So I think a lot of moves that like doesn't really take into account, you know, your body type, your flexibility, your strength, and what those things are. But definitely is a huge variety. Even in studios, I've taken classes at studios that I'm like, oof, this is intermediate. This seems really hard. Yeah. They're like, here's our inspiration from Natasha Wang for the day, who is amazing, and I love her, but I would consider a very advanced puller. So, yes. So I definitely think that there can be a big skew in there on what is considered beginner or not.
Definitely.
So, and I remember when I started out, beginners were like doing spins and like maybe working on climbing, but really not leaving the floor too much. And then intermediate was like working on inverts, and advanced was like up from there. But I feel that now that is not the case.
Yeah, and varies wildly as well. And even if like a class has, you know, a set of prerequisites that makes you think these are the sorts of things you'd be working in there, that's not necessarily always the case. As I don't anymore, but at one point I dropped in at a lot of different studios around the country, and it's very variable, right? And I think it's important for students to know that, particularly if they're traveling, if they're going to different places. And I think there's this idea that like levels, like level 1, 2, 3, 6, I don't know, are standardized. They are not in any way. That is almost certainly studio specific to your specific studio. And also, you know, sometimes it'll be gated on like a single move, like an invert. Sometimes it'll be gated on like a selection of moves. Sometimes it'll just be like self-selection. Sometimes it'll be the specific moves that are easy for the person who happens to teach level 3. And it just wildly varies. So if you have gone to different studios and been confused, know that it is not that you are bad at understanding pole. It is that it is confusing.
Yeah, I would agree with that. So, and there can be pressure, I think, when you're in a class. Like, I don't know, I do appreciate instructors that are very encouraging, but sometimes I think they encourage people to do moves they're not ready for. And it can be nice to just kind of walk it back and be like, it's totally fine that you can't do this. We're going to work on what, like, you know, if I was teaching a handspring and they couldn't do an Aisha, I'd be like, how about we work on getting you to an Aisha and try and work on that first instead of progressing them up. Yeah,
absolutely. Or even like, you know, and this is how I tend to think of moves, right? And I will say, first of all, like I cannot do an Aisha with 2 straight arms. I can do an elbow Aisha. But if I had a student in a similar situation, I'd be like, okay, how are you on the progression of things like inverting from the ground, inverting aerially? How's your reverse climb? How's your, pole handstand with your belly to the pole and your feet on the pole, right? Like, do you have that pushing strength? Because I think especially and you've been working with instructors who have like a lot of their sense of self and identity tied up with like the specific tricks they can get their students to do, which I understand how you get there. I think that there are better ways to, you know, build your identity and feeling of self-worth and goodness as an instructor. But that's a separate discussion for a separate day. It can be really easy to be like, oh, I have to get this one thing and not understand that this is a bead on a string, and the string is part of like a bead loomed like tapestry, and also it's 3-dimensional, right? Like there's a lot of things that connect to it that you can begin playing with no matter your level, right? So even if someone's coming in for the very first time to pole and they're like, I want to do a handspring one day, I'm like, great, we're going to talk about down dog. We're going to talk about what a stronghold looks like, right? We're going to talk about all of these things that will eventually build towards here, and here's how specifically it will. Like, I'm not just picking random movements, but also you don't have to do that, right? Like, it can be very helpful to decide what in the three-dimensional bead tapestry you work on if you have a specific goal you're working towards. But also, if you just do that, you've got one line of beads and that's it, as opposed to this, a lot of choices, a lot of colors in your toolbox, a lot of, I don't know that words in your thesaurus makes you a better writer necessarily, but a lot of words in your thesaurus sort of thing. So my little rant about it's good to have goals if they help you have a more fulfilling journey. I think they can also make you have less fun.
I think that's a thing I think about a lot too. With people who are dancing, it's like, if you're just doing this for fun, there's no reason to like push yourself to do stuff that you're not enjoying. And that includes, like, sometimes I feel like people put a lot of pressure on themselves in choreographed classes. And it's like, if you're not enjoying it, like, you don't have to do choreography. You can do freestyle. You can, like, if you do like kind of checking off different tricks, you can work on those. I think there's like a little bit of everything for people in pole. So
yeah, and I think that's one of the benefits of being able to connect with people on social media is you do get to experience a lot more and learn from different folks, which I think is great. And I think one of the downsides is that we have this sort of like narrowing of an idea of what it means to be good at pole or good at being a pole dancer or successful as a pole dancer. Not even professionally, just as like someone who's doing it for fun, right? Like, I can't call myself a real pole dancer until I can handspring, for example. Yeah. You're a pole dancer because you've touched a pole. You've done it. Yeah. Check. You dance. There's a pole. Congratulations.
I remember reading Amanda Palmer's, what is it? The Art of Asking, something like that. Anyway, she has a whole thing about like, trying to decide when she was an artist, and she kept waiting to like realize that she had like made it. And it's like, no, if you're singing and you're dancing, you're a dancer. You can say you're a dancer. You don't have to be doing any XYZ thing. And nobody is going to come along and be like, you made it today. You're officially a dancer. So
yeah, absolutely.
That's nice to think about.
And if anyone's, trying to gatekeep being a dancer, maybe they don't have your best interests at heart, and maybe they are not secure in who they are, and they're trying to push you down to make themselves feel taller. And maybe you should, find a different space.
Yeah, I would agree with that.
We were just talking about progressions and just sort of learning pole and what that process can be like and what it can feel like. And I think sort of the sort of flip side of the coin of progressing is regressing. And I think that's something we don't talk enough about in pole, right? Like, I would say, to pick an arbitrary point in time, if you talk to every pole dancer who was pole dancing in 2020 and you drew a line to now, I think lots of people would be able to do fewer things. I'm people. I can do way fewer things. And when I was, I actually got like, my phone was like, a memory from earlier. Look at how good this pass is. And I was like, you're right. There was a lot of stuff in that. And it looked, very crispy and much easier than it is now. But that's part of the journey, right? That's just part of the process. You're not going to continue learning more things forever. And I'm interested to hear your perspective on that. Again, both as a pole teacher, but also as, someone who is a professional knower about bodies and who works in rehabilitation, right? Because I imagine most of the people you are talking to who are dancers are in the progress of actively regressing due to their injuries or whatever it is that they're seeing you for.
Yeah. I think the way I try to frame it for people is that sometimes it's nice to actually have a little bit of these, every sport usually has like a deloading time period, and we don't always do that in pole. And so I like to sort of reframe injuries as just kind of like maybe a little bit forced, but a time of deloading where like you don't always, like, sometimes you do come back like even better than you were before, or you're able to do things differently in a way that works for your body. and isn't always like a regression in the way that we think of like, oh, I'll never be able to do this again. So I think it allows you to kind of experience those highs and lows and get back to doing the things you like, maybe in a way that is more sustainable. I don't know about everyone listening, but I would love to be dancing when I'm like 90. So I like think about that frequently. And I'm like, I could push myself to do one more of whatever, but I would rather like take the time off that I need to do the rehab or the exercises, cross training, et cetera, that I need to do, and then kind of move on from there. I also think it's nice to kind of retrain basic things that like I frequently will take like a beginner class. And like I said, I'll do it on my left mostly and try and see. But there's stuff in beginner class that is like fun. And I'm like, oh, I haven't thought about doing this spin in a long time. And I don't think of it as a regression. I'm just like revisiting kind of skills that maybe I have let fall to the wayside. And so I think there can be benefits to regressing, but I hear you that it is tough when you see stuff. I've watched past performances and I'm like, oof, I cannot do half these moves anymore. But it's cool that I could at one point. So
yeah, yeah, absolutely. And I think it's for my for my students and members, I see other people say deloading is good too. It's not just me. I'm not the only one who's into it. We do a deloading week as part of my studio program every month.
I love it.
Yeah. But the other thing that we were talking about sort of like just focusing on the one beads of string and not the rest of the tapestry is I find that it's very rare, and that of course no injury or illness or something else aside, I find it's very rare for me to regress in everything evenly. Generally, some things get harder, other things get easier, and other new skills will come up, right? So it's more like adjusting the equalizer rather than turning the volume down, if that makes sense. And again, people's experience may vary, but I think it can be helpful in my experience to focus on what is new, what is easier, and what's harder, and just be honest about it. Be like, yeah, this used to be easier, now it's harder, but not just focus on the things that you could do with more ease in the past and can do or not do could do with less ease or just can't do now, because really dwelling on that makes it feel worse, and then you get this like self-defeating little like snake eating itself sort of mindset where you're like, it's all bad now and it's gonna keep getting worse forever, and then you don't actually do your conditioning because you're too busy feeling bad about yourself. Anyway, not speaking from personal experience or anything.
I would agree with that. And I think also when you're in that spot, it doesn't mean like, okay, if you're like, let's say you do have an injury, it doesn't mean you can't pull at all. Maybe it just means you have to modify and do a lower intensity, avoid certain moves. Like there's normally a way to modify your movement that allows you to still do the things that you like to do without like causing yourself further injury.
Talk to your care team first though. Don't just come in falling on injuries because you're like, Dr. Val said I could. No. Dr. Val said there is usually something you can do, not just keep doing the thing that you were doing with no changes and no consultation.
Yes. While doing more PT, whatever you need to do, also you can modify.
Yes. Yeah, I would say it's probably pretty rare that there's an injury where you can just keep doing what you were doing and it will get better. But
it'd be nice if there were.
Yeah. I'm just sort of like thinking about what it could be. Maybe it's something that like we don't use in pole. But we use everything in pole. I don't know. Maybe if you have like an eyelid injury, you can wear an eye patch and keep pulling and it'll be fine. Well, I don't want to keep you too late because I know it is, like I mentioned, getting a little bit later in the evening. But if folks are interested in working with you or they wanted to learn more about what it is you do, I know you've got some art projects going on as well. Where could they find more?
Yeah, I work as a physical therapist in Washington, D.C. At Rose Physical Therapy. And then I also dance with a company called Alchemy Performing Arts. And we do a lot of gig work. So if you're looking for aerialists or pole dancers for an event, you can kind of reach out to us, and we do a lot of that. And then I'm also at Pole Pressure, which is on 14th Street in DC.
Oh, absolutely. And I'll have links to your Instagram as well down in the area. So if folks want to follow you on Instagram, they definitely can, and follow your handspring journey.
Yes, we'll see how it goes. Well, it was so nice to meet you.
Likewise. And thank you for making time to come chat with us. I think it was a really, I don't know. I had fun and thought it was interesting, and I'm sure folks who are listening did too. Thank you for listening. I hope you learned something. If you want to do more research on your own, if we talked about specific studies, I always try to have the citations in the show notes so you can check them out for yourself. A great place to continue our learning. Speaking of continuing your learning, if you do want to work with me as a pole instructor, I teach online at my online studio, Slink Through Strength, and it would be great to have you come join us. I teach freestyle flow, I teach conditioning, I teach flexibility, and I teach pole in the nerdiest way possible. But we have a good time, and we'd love to have you join us if that sounds like fun for you. And if not, no worries. Either way, I'll see you in the next episode. Have a good one.